Namaskar and welcome to News Night. I'm Shubhendu Ghosh. While India is charting a hard-fought recovery from the deadly second wave of COVID-19, there are several myths doing rounds, especially with regard to centre's role in the vaccination drive. It's crucial to separate myths from facts, and we'll seek to do that in the show up ahead. In other news, review and relief work in the aftermath of Cyclone Yas. Fugitive jeweler Mehul Choksi, who had fled to Antigua and Barbuda, had been captured in Dominica. All that and more. First, the top stories. Dr. V.K. Paul, member held in Niti Aayog, clears air over vaccination program, says India is engaged with Pfizer as they've indicated availability of vaccines in the coming months. The External Affairs Minister Dr. S. Jaishankar also says there is a deliberate political effort to depict the current government in a negative way. India continues steady battle against COVID-19. Recoveries continue to outnumber the daily new cases for the 14th consecutive day. Daily positivity rate at 9.79%, less than 10% for 3 consecutive days. After the US, India is the second country to achieve the 20 crore vaccination doses landmark. Union Health Ministry issues guidelines for near-to-home COVID vaccination centres for elderly and differently abled citizens. All 60-plus citizens with no vaccination or first dose of vaccination, along with all citizens below 60 years with disabilities, are eligible for COVID-19 vaccination at these centres. Centre approves financial assistance to 67 families of journalists who lost their lives to COVID-19. Each family to get Rs 5 lakhs under Journalist Welfare Scheme of the INB Ministry. Committee decides to hold JWS meetings on weekly basis to process applications expeditiously. Prime Minister Narendra Modi chairs meeting to review impact of Cyclone Yas. He will visit Orissa and West Bengal. Tomorrow, Cyclone Yas weakens further. Flood-like situation in many parts of Orissa and West Bengal following heavy rains. And Antiguan Prime Minister Gaston Brownie says Mehul Choksi has been traced in Dominica. Brownie requests Dominican government not to return Choksi to Antigua and directly deport him to India. Now, as the active number of COVID-19 goes down, the daily recoveries have been increasing. Much of the focus of the administration in the days ahead would be on monitoring the gains made to tackle the second wave. After United States, India is the second country to have achieved the 20 crore vaccination landmark. Meanwhile, Centre has dismissed reports appearing in different media regarding the actual number of casualties, deaths due to COVID-19 pandemic. Here's more from the Health Ministry press conference.
India continues to fight the COVID-19 global pandemic. Continuous efforts have seen the reduction in active cases by a margin of more than 75,000. At 2.11 lakh cases, declining trend in new cases is maintained. So far, India has registered 2 crore 46 lakhs 33,951 total recoveries across the country in last 24 hours, while 2,83,135 patients have recovered in the same period. Recoveries continue to outnumber the daily new cases for the 14th consecutive day. At the same time, the national recovery rate has increased to 90.01%.
एक स्थाई पर देश में रिकवरी 81.8% 3 मई को नोट की गई थी, वह बढ़ते बढ़ते 18 मई को 85.6% और हम देश में देखते हैं तो पाते हैं कि हमारी रिकवरी परसेंटेज अब बढ़कर 90% हो गई है। यह एक बहुत ही पॉजिटिव इंडिकेशन है। जरूरत है कि हम इसी स्थाई से अपने होम आइसोलेशन केसेस और वह केसेस जो हॉस्पिटल में उनको मॉनिटर करते रहें।
So far, 20.27 crore vaccine doses have been administered through nationwide vaccination drive. After the USA, India is the second country to achieve the 20 crore vaccination dose landmark. Government of India has so far provided more than 22 crores vaccine doses to states and union territories. Of this, the total consumption, including wastages, is 20 crore 17 lakh 59,768 doses. More than 1.85 crore COVID-19 vaccine doses are still available with the states and union territories to be administered. Furthermore, more vaccine doses are in the pipeline and will be received by the states and union territories in due course.
गवर्नमेंट ऑफ इंडिया की तरफ से फ्री ऑफ कॉस्ट जो हम स्टेट्स को प्रोवाइड करते हैं उसके अंडर दिल्ली में 45.46 लाख डोजेस दी गई हैं और जो अवेलेबल इंफॉर्मेशन है उसके अंतर्गत डायरेक्ट प्रोक्योरमेंट जो दिल्ली गवर्नमेंट ने किया है वह 8.17 लाख के करीब है और प्राइवेट हॉस्पिटल ने जो प्रोक्योरमेंट किया है वह 9.04 लाख के करीब है। अब तक जो टोटल डोजेज एडमिनिस्टर्ड हुई हैं दिल्ली में टोटल मिलाकर देखें तो वह करीब 52,25,000 के करीब हैं और जो अवेलेबल डेटा हमारे कोविन पोर्टल पर 3.8% ओवरऑल वेस्टेज भी नोट की गई है। जो हमने टोटल डोजेज दी हैं उसका करीब 13% जो है वो प्रोक्योरमेंट स्टेट लेवल पर हुआ है, बाकी गवर्नमेंट ऑफ इंडिया के अंडर में दिया गया है।
Pace of vaccination has also picked up to some extent now. We are back to clocking 20 lakh per day. And this will further increase. A very major effort will now be made to further streamline the coordination along the three channels of supply, and certainly the vaccination pace should pick up, and going forward to July we have a total of 51.6 crore doses. A large proportion of that's available, and that has to be used in an efficient manner, even as we build our efforts to increase the stockpile with time to come.
The centre is extending all possible assistance to the states to strengthen the health infrastructure. So far, 18,006 oxygen concentrators, 19,085 oxygen cylinders, 19 oxygen generation plants, 14,514 ventilators by PAP, approximately 7 lakh remdesivir vials, approximately 12 lakh favipiravir tablets have been delivered to the states. Meanwhile, Indian Railways is continuing its journey of bringing relief by delivering liquid medical oxygen to various states. Railways has delivered more than 18,980 metric tons of liquid medical oxygen in more than 1,141 tankers. 284 oxygen expresses have completed their journey so far. Oxygen expresses delivered their highest single day load of 1,195 metric tons oxygen relief to the nation. The nation continues to deploy all available resources to fight the global pandemic and will continue to do so till absolute victory against the deadly virus is achieved.
And that brings us to the issue in focus this evening. We're talking about COVID-19, recovery and road ahead. An eminent guest is joining me for this conversation. We have with us Dr. V.K. Paul, Member Health, Niti Aayog. COVID-19 recovery and road ahead is what we're going to discuss. And Dr. V.K. Paul is joining us to take the conversation forward. Dr. Paul, good evening and welcome to the program, sir. While we talk about the developments on the ground, if you could first begin with a lot of misinformation and myths that are doing round. And the case in point is a startling claim, an article by a reputed institution like New York Times that says India's death count could be 3 times the official figure as per their own speculations. What do you make of it, sir?
I think that piece in New York Times is really motivated because, you know, they use assumptions. Somewhere they use astrological data and then they make assumptions and simply multiply some numbers and put out figures that are, you know, unwarranted and unsubstantiated. You know, for example, we do know that those who are tested positive and are counted as cases today, this population, it is a fact, is part of a larger population which has been infected. If people get infected and they are totally asymptomatic, they are not known contact of anybody else, they will not get tested. And there is no way for us to know who these people are. But when you do a sero survey, then serology positivity picks up these people. So in the sero survey of December, January, we noticed that for every positive case that was recorded and tested and confirmed, there were as many as 26 cases who were not detected and they are part of the infection pool. To that extent, no problem. So if we say that there are 1 crore positive cases to a particular date, it could actually mean that these are about 25 crore people, because asymptomatic infections are so well known and they are so overwhelmingly more. The problem arises when they put certain numbers as mortality, which they pick up from the blue. There is no basis for picking up, a factor of 0.3% infection fatality rate or 0.6. Suddenly they do multiple scenarios and an overwhelming number comes up. That's not how it is done. I also want to emphasize that even in a survey in New York City, for example, there were about 2 lakh cases up to a particular date. When the sero survey was done for that period, then the number of cases was detected to be meant to be 17 lakh, 8-9 times. But then you don't assign deaths just like this to an astronomical figure. So the official death toll of that period continues to be there 16,000, and not using a multiple like 8, for example, and to say it is 1,50,000 or 70. That's not how you do science. There has to be some basis for this. So I think it was very conjectural, very, very presumptive, and they use assumptions which were essentially an agreement between the people who are talking rather than anything substantial.
Right. I'll come to that point about the credibility of this media organization, Dr. Paul, but the speculation also seemed to put into doubt the mortality tracking mechanism that is followed in India. So if you could give us some insight about how robust is the system where the deaths, the casualties are properly monitored and tracked in the country.
Well, remember, India has multiple tracking systems for mortality. One is a civil registration system, and in fact, in the states where pandemic has been very intense, such as Maharashtra, Tamil Nadu, Kerala, the civil registration system, that means certification of deaths by facilities and formal providers, is very, very strong. And then there is a vital registration system, which reports, periodic surveys, and this is a sample registration system which is operating in our country, which tracks mortality in sample locations in the country and very respected. SRS surveys our data are very, very highly respected in the world. That system is available. Then in addition, for COVID-19, there is another robust system to track mortality, because we are monitoring this disease so intensely, and there is a sort of an additional system or complementary system put in place to track mortality. It is possible that sometimes some data has been entered later than on a particular date. There could be delays. Sometimes we may not really know that a patient died and had COVID if the testing has not been done. That can happen in a remote location. But to holistically demolish credibility, or try to demolish the credibility in this manner, is very, very unfortunate. And these numbers in a democratic country, death numbers cannot be hidden, and these tracking systems that we have established will tell the true picture. But to sensationalize and to put down a country like this is really unfair.
And this attempt at sensationalizing a pandemic, a crisis that the entire world, in fact, is facing, Dr. Paul, I want to ask a larger question about the certain bias that a section of media carries against India, because External Affairs Minister Dr. S. Jaishankar also made that point. And here in the New York Times article, that point is also exemplified. Without proper research or data, speculation, and you've said it a couple of times, it seems few people have just got together, cooked up data and presented an article. Do you see a larger issue of concern here?
Well, what I said was that some people got together, agreed on certain assumptions without basis, just an agreement among themselves, and made estimates. without any data available from the ground. They have used assumptions which may be applicable to another country.
Right.
So that is where one has to be sensitive to do these analysis, and one has to be grounded in science to use these assumptions. And it is sad that a narrative was created to make us look bad. But having said that, I think it is time that we work together. We work together as scientists, as people, as citizens, as stakeholders, because this pandemic is to be fought and defeated as a nation. And we respect science. We work on the basis of scientific principles to fight this pandemic. And indeed, there is always a room for discussion, refinement of the methods, and refinement of the strategy based on science, and ideas emanating from scientists from our country or any other country are truly welcome. So to that extent, the role of scientists and academics is so very important, and we respect that in our own country. While fighting this pandemic, there are multiple structures in which scientific interface is made on an ongoing, continuous basis. But it is not, right to deliberately create a negative narrative.
Right. Sir, if you can talk about the developments as far as the COVID situation in the country is concerned. There's been news of hope. The cases have been going down. You've said in the press conference that there is a need to monitor now the districts, the areas where the cases are still high. Now, what would be the yardsticks, the districts where the cases have gone down, the states who have been able to control the numbers? What are the key takeaways that we could apply to the places which still have to put up work to reduce the cases?
Well, remember, we have achieved stabilization of the second wave as a nation because of a huge collective effort of people, of state governments, central government, district authorities, and people at large. And this has also been helped, not only because we have been testing, we have been containing, we have been promoting and exercising COVID-appropriate behavior and ramping up vaccination. But also, in recent times, practically all the states have imposed restrictions of various levels, which are, of course, at the cost of normal socio-cultural economic activities. But then they have helped in stopping the chains of transmission and bringing the virus to slow and to halt itself. So remember that this has been achieved by doing things. It has not happened on its own. It is not the virus's nature or a decision that it wants to go slow. It is because we collectively have taken measures to make the virus slow down. And therefore, it remains our duty that we do not now allow the virus to have a free run once again.
Right, and so we understand that.
Very, very important responsibility on the part of all of us to make sure that COVID-appropriate behaviors are followed, vaccination is scaled up, containment happens, testing moves on without any decline, following the high scientific principles. And as we loosen the restrictions in near future, we should not go back to a situation like it was post the first wave, when we allowed the virus to then traverse back and forth. So we have to run our livelihoods, run our socioeconomic life, but do it very, very carefully. There is no room for complacence.
And right, and so on the aspect of scaling up of the vaccination drive, which is central to controlling the pandemic, doubts are being raised, questions are being asked if Centre is doing enough to procure vaccines from abroad, and especially in the context of states trying to do it on their own but not able to. Then should the Centre come to the rescue and deal with the situation? If you could clear the air on that part, sir.
Well, firstly, remember, our approach to securing vaccine comes from both the tracks. One, it comes, and largely it continues to come from our support and ramp up of domestic production, and creating a repertoire of vaccines coming into future, and then ramping it up in large numbers. So that track is moving pretty much well. On the availability of internationally produced vaccine, as I stated, multiple organizations, departments of the ministry collectively have been in touch with all the key manufacturers of the world, and we have been requesting them to come and make in India, fill finish in India, and to supply to India. And it is only now that a particular company is in a position to offer some supplies, some significant supplies to India. And we are therefore taking cue from that, are working feverishly to pave way for such a supply in the shortest period of time coming into future. Also remember, one in particular international product, the Sputnik vaccine, has already been imported into India in 2 tranches and is slowly being ramped up in pilot mode. It's already happened. It's being ramped up in other cities now. So that is already happening, and a few more million doses will come, and we're looking forward to as much as 2 crore doses about 8 weeks from now, and following a schedule. We are also in touch with other players such as Moderna and Johnson & Johnson for finding ways in which those vaccines can be brought into India the soonest, and also requesting them to produce. And Johnson & Johnson, of course, is going to produce in India with a tie-up with an Indian company in Hyderabad. But we are hoping that the part of the stockpile can come from such imported vaccine, even as our large requirement will be met through domestic production, for which our companies have done tremendous job.
Right, sir. And sir, on that particular aspect of states trying to procure vaccines from abroad, in many cases failing, how do you think the road ahead could look like?
Yeah. You see, the liberalized policy was triggered by the suggestions from the state governments to have flexibility and to be able to inoculate population groups which normally the center was not focusing on or not offering vaccines at that particular stage. And they wanted flexibility, and therefore this flexible mechanism was created. States knew all along what the overall situation of India's production is, and the states also had an idea how much availability or lack thereof is available in the international market. Nonetheless, it is fine to seek out and to procure. There could have been some possibility here and there, but as we are realizing, the big picture is such that global supplies are limited, and it is not easy to procure, and going from by state to state looks like competition of sort. So this reality is now there for us to learn from. But the fact remains that, it is the fight against the coronavirus, the SARS-CoV-2 virus is a national fight. We have to fight this together, state, center, districts, people, all stakeholders.
Right, and some
every village, and therefore, as we experiment with some of these ideas, we must come together, make the best use of the options that are available, and move toward defeating this virus through increasing acceleration of the vaccination program.
Right, and so some good news came in today also from the government for the elderly population and differently abled. They will be able to access vaccination from near their homes and won't have to travel far distances. But how soon before we see that turn into a reality on the ground, sir?
Well, initially, because we were dealing with a new set of vaccines, we were dealing with adult population, which is usually not the target of vaccination program. And we were dealing with vaccines that were under emergency use authorization because of relatively less experience in the research and development time. And therefore, extra caution was needed to watch for reactions, if any, due to the vaccines. And therefore, it was to be done only in the facility, and one has to wait there carefully under the watch of healthcare providers. With time, we now know that the adverse effects are rare, and we are now feeling confident that that kind of a watch can also be instituted away from the facility, close to the locations and the habitations where people live. And definitely, in order to move in that direction, the start has been made by offering this approach to the most needy. The most needy and the most special people are the elderly, and the most special people are those with who are challenged in different ways. Therefore, a very important start would be now made that these citizens, these brethren and sisters of ours, can receive vaccine close home by teams that follow protocols, and they do not compromise in every which way for the safety, for sterility of the procedures, for the quality of the vaccine and quality of watch that is required. So a new SOP has been now created, which will take vaccine closer to the most needy of our population.
Right. Dr. Paul, while thankfully the numbers have been going down consistently over the days, what is your assessment of the kind of impact that this deadly second wave has had in rural India, which we looked at as far more vulnerable than the urban spaces with better health facilities?
Essentially, the original first wave, the first part in particular, was in metro cities with high population levels and high density population areas. And high density areas within the cities, particularly the slums and so on. As the pandemic panned out further, it opened up its presence in overall large cities, and then tier 2 cities and tier 3 cities. And because the vulnerable population continues to be in rural areas, having been unaffected so far, this time the wave also reached some rural areas. I'm happy to state that as the pandemic is now shrinking, much of the rural area is still protected. Or large parts of rural areas in different parts of the country would still will be saved from this. And it is possible for us, if we follow the principles of pandemic protection, pandemic prevention, and control, the rural areas will remain protected in future. To have or not to have the third peak, which could possibly have a bigger presence in rural areas because of continuing vulnerability, is in our hands. If we continue to push the tools of pandemic control, testing, containment, COVID appropriate behavior, clinical care, vaccination, and judicious but timely use of restrictions, there should not be a third wave. And if we can buy time for 5 months, and significant proportion of our people are vaccinated, there should be no room for us to have a similar situation in the future. But don't take it for granted. Virus can change its characteristics. Viral mutants can emerge, and they can change the game plan of theirs, and to change the structure of the game. And therefore, from this deadly and unpredictable and ruthless virus, we have to continue to fight with collective will, determination, and implementation of all the tools effectively.
And perhaps COVID appropriate behavior, sir, would also remain crucial. Dr. V.K. Paul, on that note, thanks very much for joining us in Newsnight and sharing your perspective. And an important development news that is coming in, the government has announced assistance for kin of journalists who've died due to COVID-19 pandemic. The government has announced financial assistance to 67 families of journalists who've died due to COVID-19. Financial relief of rupees 5 lakh to such families of journalists will be provided. Financial assistance under Journalist Welfare Scheme is going to be provided for the journalists that we've lost during the time of the pandemic. Important news that is just coming in. And we were talking to Dr. V.K. Paul, member health in Niti Aayog. Earlier in the day, he cleared the air over the procurement of foreign vaccines and ramping up domestic production. He said that government is playing the role of an effective facilitator to enable more companies to produce vaccines. Meanwhile, External Affairs Minister Dr. S. Jaishankar said that there is a political effort to depict the current government, India's government, in a negative way. More in this report. Several myths on India's COVID-19 vaccination program and the country's handling are doing rounds, and all these myths are arising due to distorted statements. Member Health in Niti Aayog and Chair of the National Expert Group on Vaccine Administration for COVID-19, Dr. V.K. Paul addressed these myths and during a briefing on Thursday gave out the facts regarding vaccines. He clarified why vaccines developed by a country were supplied back to the same country.
The vaccines developed in other countries, a large part of those vaccines was supplied to the same country. So the US-made vaccines went in a big way to the US, and that was taken for them as a priority. And it is nothing surprising, because when we look upon our vaccine manufacturers, they also unhesitatingly offer the vaccines to our own nation. Now that the vaccine availability for their countries of origin has been met to a large extent, the companies are, and their own production capacities are also rising now that they are confident of the market and the success of the vaccine. That's how our companies will also do. There will be vaccine which is available for others to take. But clearly, the countries of origin have been an important priority for the producers of vaccines. So now it's available for other countries, partly through COVAX, partly through bilateral arrangements, and often these are small countries with small requirements. So it's a changing scene. But to begin with, a focus on their own respective countries and countries with which they have special arrangements has been a way that has been followed.
He also said India is engaged with Pfizer as they've indicated availability of certain volume of vaccines in the coming months, possibly in July.
We are engaged with Pfizer because they have indicated availability of certain volume of vaccine in coming months, so possibly starting in July. And we are looking at what their expectations from the government are, and they are looking at what our expectations from them are. Other vaccines in the pipeline are moving close to increased supplies, such as for Sputnik, and also rapid development for such as Zydus vaccine, BioE vaccine, and also Genova vaccine.
Earlier in the day, Dr. Paul addressed many other myths. The Prime Minister's office tweeted and said, crucial facts on India's vaccination process, which addresses diverse topics such as ramping up domestic production, getting vaccines from overseas, ensuring adequate vaccines to the states and more. External Affairs Minister Dr. S. Jaishankar also said on Wednesday that there is a political effort to depict the current government in a certain way. The minister gave the statement while holding a conversation with former United States NSA H.R. McMaster on Wednesday.
We are going through a very stressful time right now because of the pandemic. Okay, we are actually giving free food last year for multiple months. Right now, again, because of second wave, we resumed to as much as 800 million people. Okay. We put money into the bank accounts of 400 million people. Okay, this is what this government did. Now, if you are, feeding more than 2.5 times the population of the United States, and you are funding more than the population of the United States, and you are doing this, pretty much anonymously and impersonally, in the sense beyond the name and the detail, the bank account of the person. You're not asking anything more. There's no criteria of discrimination. So I think when you come down to real governance judgments, you find that there is a difference between the political imagery that has been concocted and actually the governance record out there. So I think you should take it for what it is, which is really politics at play. You can agree with it, you can disagree with it, but I would certainly see that very much as part of a political effort to depict our current government in a certain way, and obviously I have a very profound difference with that.
During the conversation with former US National Security Advisor in Battleground session on India's opportunities and challenges for a strategic partnership, External Affairs Minister emphasized on the need to be self-sufficient for essential things.
For essential things, we need to be self-sufficient, or we need to de-risk our exposure, that we shouldn't be over-dependent on single geographies or one set of supply chains. So I think the post-pandemic conversations, in fact, even as the pandemic is going on, the conversations are beginning to change towards more resilience, more reliability. How do you de-risk the world? And to my mind, it really makes an argument for what I would call decentralized globalization.
S. Shankar, who is on a 5-day visit to United States to meet senior officials and talk about COVID-related cooperation between both the countries, Modi government is leaving no stones unturned to fight the pandemic. The results are visible as the cases are reducing every day. Bureau Inputs, Lead India. And continuing our coverage of the manner in which the pandemic is unfolding in the country, there are a lot of myths and misinformation doing rounds, especially related to what the government, what the centre is doing vis-a-vis India's vaccination drive. The government has cleared its stand. It's spoken about facts as against myths. We'll look at them one by one. Myth number one, the centre is not doing enough to procure vaccines from abroad. The government says it is in fact engaging with all major global vaccine manufacturers to make sure that the vaccine deficit is maintained. Moving on, the same myth, all assistance, in fact, the government says, is being offered for the foreign manufacturers to be able to supply and also manufacture these vaccines in the country. Moving on to the next point, multiple rounds of discussions, in fact, have taken place with newer companies like Pfizer, Johnson & Johnson, Moderna, and the conversation has been on to procure these vaccines for India. In fact, Sputnik vaccine, the availability that has become now, accelerated with timely approval granted by the government. So we're talking about the different myths doing rounds and the kind of rebuttal that the government has given with the fact. Myth number two, centre has not approved vaccines available globally. The government has said it's not true, and the facts that the government has given is that the entry in fact have been eased for vaccines approved by US FDA, EMA of United Kingdom and other such agencies of different countries. In fact, approval given to WHO emergency use listing, all the vaccines listed by WHO, all of them have been approved for emergency use in India. Moving on to the next point, vaccine will not be need to undergo trials. Now, these vaccines that have already been approved by different international bodies and WHO will not have to go through the tedious process of trials when they come to India. So that approval has already been granted. No approval application, in fact, is pending as far as the Drug Comptroller General of India is concerned. There is no such application that is pending at the moment. We're trying to bust the myths that are doing round vis-a-vis India's vaccination drive. Myth number three, centre is not doing enough to ramp up domestic production of vaccines. The couple of vaccines that are present in are being produced in the country. The government has provided the facts and has busted the myth. It said co-vaccine production, in fact, has been increased from under 1 crore to now 10 crore doses per month. So that's the way it has been ramped up. From Covaxin to the second one, Covishield production has also been increased from 6.5 crore per month to, in the coming months till about October, it is expected to reach 11 crore doses per month. So it's a clear rebuttal of whether the government is doing enough to increase the doses. Moving on, Sputnik, in fact, will also be manufactured in India with the help of 6 companies in the country. Dr. Reddy's Pharmaceuticals will play an important role in that. Continuing with myth number 3, liberal funding for new vaccines by Zydus Cadila, Genova and others, in fact, has been provided by the government so that newer vaccines could be researched and developed within the country. Also, an estimate by the government says, with all the efforts that it is doing, some 200 crore vaccine doses will be available for India by the end of 2021, with all the efforts coming together. Let's move from myth number 3 to myth number 4. It says centre should invoke compulsory licensing. Now, what that really means is that whatever vaccine is available, other companies should also be able to produce it so that more vaccines could be available for people. Now, the government has said that partnership with the manufacturer is more important than simply sharing the formula of the vaccine. Simply sharing the formula will not happen and not help, and tech transfer is the key. Technology transfer to have the appropriate infrastructure to be able to produce the quality of vaccine that has been done by the original manufacturer is the key, not just sharing of the formula. Also, promoting partnership to enhance production of Covaxin and Sputnik is already being done by the government. So the thing that it is talking about, that sharing of technology is important, that is already taking place. Myth number 5, centre abdicated its responsibility to the states and said that states have to fare for the vaccines themselves. Centre said it is not true. Talking about the facts, centre in fact is engaged in all aspects of a vaccine drive, vaccination approvals, funding, production, foreign procurement, the ways we just saw in the earlier points, and therefore it is doing all it can to provide the adequate support to the states. However, the point about states being unable to procure vaccines from abroad, vaccine policy liberalized, it was liberalized because the states demanded more power in the matter. Earlier it was the centre that was procuring, getting the vaccine, providing to the states. States wanted more power, more say, they wanted to do it directly. They've not been able to, is a matter of concern. Meanwhile, we also have to come to terms with the fact that it is a pandemic. There is a great shortage of vaccines, not just in the country, but also abroad. And vaccine is in short supply globally. It's not easy to procure, the centre has said clearly on a short notice. So the mechanism that is there to procure vaccine, the centre is following those mechanisms. Moving on to myth number 6, centre is not giving enough vaccine to the states, as if holding it aside and not giving it to the centre. Centre has busted the myth and said that centre in fact is allocating enough vaccines, whatever that is available, to the states. It also gives a ratio of the manner in which it's making the allocation, the share of the states informed in advance about the vaccine availability. The data is available with the states as far as availability of vaccines are concerned. Moving on, the centre has also asked states to stop politicizing the issue of vaccine limitation. It's a fact. It's a limitation for the centre, for the states, for the country and for the world, and we must make do efficiently with the resources that we have. Moving on, we're talking about India's vaccination drive and the myths that are doing round and the manner in which facts have been provided by the government to deal with it. And vaccine availability is going to be increased in the near future, the steps that the government is taking. So in that manner, in time, the requirement of individuals, of states will be fulfilled, the centre says. Moving on to the final pointer, myth number 7. It says centre is not taking any step to vaccinate children. We're talking about vaccination of adults. What about our youngsters? Well, the fact is the centre has said that it's not just India. No country in the world is giving vaccination to children. As of now, about the safety concerns of those vaccinations are not still in place. There is no clear recommendation by World Health Organization either, without whose approval it is risky to take the vaccines to youngsters, to children. The government says initial studies about safety of vaccines for children are encouraging. These studies are not complete, and importantly, trials for children in India is to begin soon. And once the trials are complete, the safety of vaccines for children are established, then perhaps the drive to protect children from the pandemic through the means of COVID vaccines could be taken forward. Those were some of the key myths that we tried to bust and the facts that exist on the ground. We're heading for a short break. Lots more coming up in Newsnight. Stay with us.
With the world's largest COVID vaccination drive, India is leading the way. as the vaccine reaches every corner of the nation. Do not forget the mantra, Dawai bhi, Kadai bhi. Let's continue our fight against COVID-19. Vaccination along with social distancing, sanitization and masks.
Mask up, India!
Put your mask on and cover your nose and be safe.
Mask up, India.
Welcome back. You're watching News Night. Some update on the pandemic situation from across the states. The COVID situation is improving in Uttar Pradesh. There is downwards trend in the new cases of infection. Various state governments have issued guidelines related to board exam for students amidst the pandemic. Delhi government has launched drive-through vaccination center to make taking jab easier. Jammu and Kashmir administration has started a special scheme for those families who lost breadwinners due to COVID infection. Here's a roundup from the states.
As the COVID-19 infection rate is coming down, the state governments are taking important decisions on board exams. In West Bengal, the government has decided to hold the board exams of 10th standard in the second week of August and 12th board exams in the last week of July. In Jharkhand, the government has decided to promote 9th and 11th students to the next classes. Meanwhile, Chhattisgarh CM claimed that the rate of vaccine wastage is very low in the state. The Chief Minister received the second dose of the vaccine and said that in view of the reduction in cases of infection, restrictions would be relaxed in the state soon.
मार्केट ओपन हो गया है, सब जनजीवन सामान्य करने की कोशिश कर रहे हैं, तो ऐसी स्थिति में कोरोना जो प्रोटोकॉल है उसका पालन करना बहुत जरूरी है। हम सैनिटाइजर का बार-बार प्रयोग करें, मास्क लगा कर रखें, नहीं है उसे लगाने के लिए प्रेरित करें, ये बहुत जरूरी है और समय-समय में टेस्ट कराते रहना जरूरी है।
COVID-19 situation is improving in Uttar Pradesh. There is downwards trend in new cases of infection. In the last 24 hours, 3,278 new cases were registered, while 188 persons lost their lives due to COVID-19 infection. The recovery rate in the state is improving and it has reached 95.4%. The Chief Minister is working with missionary zeal to fight the pandemic. He visited Siddharthnagar and met monitoring committee members. He said recovery rate in the state is increasing.
Recovery rate 95% से अधिक और पॉजिटिविटी रेट निरंतर डाउन है। अगर आज की हम देखेंगे तो 1 के आसपास है और ओवरऑल हम देखेंगे तो पॉजिटिविटी उत्तर प्रदेश के अंदर 3 के आसपास बनी हुई है। यानी पॉजिटिविटी रेट को कम करना और रिकवरी रेट को बढ़ाना इस पूरे अभियान का हिस्सा था और हम लोगों ने उसमें सफलता प्राप्त की।
Situation in the national capital is better now. In the last 24 hours, 1,024 cases of new infection came to notice, while 117 persons died in this period. Delhi government has launched drive-through vaccination centers to make vaccination easier. In these centers, any citizen can get vaccinated sitting inside his or her car. Deputy CM Manish Sisodia said that government is making all efforts to vaccinate people at a fast pace.
जितनी भी वैक्सीन है तब तक तो तुरंत लगवाते रहें और सरकार पूरी कोशिश में है कि ज़्यादा से ज़्यादा वैक्सीन दिल्ली के लिए उपलब्ध हो सके। हम प्राइवेट सेक्टर से भी बात कर रहे हैं, हम इंटरनेशनल कंपनी से भी बात कर रहे हैं, हम भारत सरकार से भी बात कर रहे हैं कि हमें देश में बनी हुई वैक्सीन और उपलब्ध कराई जाए।
On one hand, state governments are fighting against second wave of COVID-19, while on the other hand, they are also gearing up to fight against the third wave of the pandemic that may come in near future. A task force of high-level medical professionals has been set up in Maharashtra, headed by Dr. Suhas Prabhu. It will give directions for COVID-19 infection in children and its treatment. This task force has 13 members. Maharashtra-based Genetic Life Sciences on Thursday began manufacturing amphotericin B emulsion injections used for treating mucormycosis or black fungus. According to Union Minister Nitin Gadkari's office, it was being produced by only one company so far and available for ₹7,000. The injection will now be available for ₹1,200. In Andhra Pradesh, government has decided to postpone 10th board exams due to COVID-19 situation across the state. The decision to hold exam would be taken in July after reviewing the situation. In Tamil Nadu, government is fighting with the second wave of COVID-19. It has remained one of the worst affected states in the country. Tamil Nadu CM inaugurated a COVID care center at a women's college in Chennai. J&K Lieutenant Governor Manoj Sinha started a special scheme for those families who lost breadwinners due to COVID-19 infection. Under Saksham Yojana, such families would be given financial assistance of 1,000 rupees per month. School children of such families would be given a scholarship of 20,000 rupees per year, and college-going students of these families would be given a scholarship of 40,000 rupees per year. 2 children in the family would be eligible for this scholarship if they are not availing any other scholarship. All the states across the country are making all efforts in the fight against COVID-19. Besides treating patients and managing COVID-19 situation, they are also taking care of the affected families. With Shishir from Mumbai and Ramesh Raina from Jammu, Bureau Report, DD India.
And amid the current status of COVID-19 across the country, Ministry of Home Affairs has released an order on COVID containment measures. As per the latest order, COVID-19 containment measures, as outlined by Ministry of Health and Family Welfare on 25th of April, will remain in force till 30th of June 2021 across the country. The order released on Thursday by Ministry of Home Affairs says that to ensure compliance to containment measures for COVID-19, that was conveyed by Ministry of Health and Family Welfare, the stated 25th of April 2021. The containment measures will continue to remain in force up to 30th of June 2021. The decision has been taken considering current situation of COVID-19 across the country, exercising the powers conferred under Disaster Management Act 2005. And Prime Minister Narendra Modi chaired a high-level meeting to review the National Digital Health Mission. Prime Minister directed that steps be expedited to expand the operations under the mission. PM said that the mission will bring ease of living for citizens to avail a large number of health services. He observed that though a technical platform and building up registries are inevitable, essential elements, the utility of the platform to the citizens will be visible only by way of enabling citizens across the country to avail services like teleconsultation with doctors, availing services of a lab, transferring test reports or health records digitally to the doctor, and paying digitally for any of the above services. He directed NHA along with Ministry of Health and Ministry of Electronics and IT to coordinate efforts in this direction. On 15th of August 2020, during his Independence Day address, Prime Minister had announced the launch of this mission. Moving on, Prime Minister Modi will visit Orissa and West Bengal on Friday to assess the impact of Cyclone Yas. Earlier, he held review meet to assess the preparedness and assessment of damages. Cyclone Yas has battered Orissa and Bengal, leaving a trail of destruction. Several houses, dams, trees have been damaged in Orissa and West Bengal. Relief work is underway by the NDRF, Army and other agencies.
To review the impact of cyclonic storm Yas, Prime Minister Modi chaired a review meeting. Officials made a detailed presentation on various aspects of preparedness, assessment of damages and related matters. During the meeting, several areas were discussed. About 106 teams of NDRF were deployed with 46 teams each in West Bengal and Orissa that rescued more than 1,000 persons and removed more than 2,500 trees, poles that had fallen and obstructed the roads. The Defence Forces, Army and Coast Guard also rescued marooned persons, while Navy and Air Force were on the alert. From the preliminary reports available, it was also noted that the accurate forecasting, effective communication and evacuation by states and central agencies ensured minimum loss of human life. Due to inundation, several low-lying areas suffered damages. However, power and telecom services were soon restored in most of the affected areas. Prime Minister also noted the effective and proactive role played by the central and state agencies in responding to the challenges thrown by the cyclone and advised the agencies to ensure that normal life is restored in the affected areas at the earliest and relief is appropriately dispersed to persons affected by the cyclone. To further assess the damages, Prime Minister will visit Orissa and West Bengal on Friday. He will chair review meetings in Bhubaneswar to assess the impact of Cyclone Yas. Prime Minister will also undertake an aerial survey of the areas affected by the cyclone in Balasore, Bhadrak and East Midnapur. Prime Minister will also hold review meeting in West Bengal. With backing winds of up to 130 to 145 kilometers per hour, Cyclone Yas whiplashed the coastal areas of Orissa and West Bengal. Dumping heavy rain, Yas damaged several houses and farmlands. Thick sheets of rain swarmed blocks of houses in low-lying areas of Bengal and damaged several dams. Odisha CM Naveen Patnaik conducted aerial survey in impacted areas. Cyclone Yas hit region of Odisha. Odisha's Special Relief Commissioner P.K. Jeena said that 3 people lost their lives in the state. In the last 24 hours, state witnessed heavy rainfall, due to which Beturani River has crossed danger level at Anandapur and Akuapoda. As of now, no village has been affected.
अभी तो बारिश नहीं है, लेकिन ऊन ज़्यादा अभी चल रहा है। फिर भी हम लोग ये कोशिश में हैं, कोई लोग अगर कहीं रह जाए पानी, तो हम कल तो सब 100% इवैक्यूएशन कर चुके थे। जिनका पक्का घर था, हम उसके कांटेक्ट में हैं। अगर चारों तरफ पानी हो जाएगा तो उनको कैसे खाना पहुँचे और कैसे सही ढंग से रहेंगे, उनका कोई दिक्कत ना होंगे, ये देखने के लिए। और कहीं जगह पर अगर रास्ता बंद है, कहीं पेड़ वगैरह गिर गया होगा, तो इसको तुरंत हम इसको हटा के कैसे रेस्टोरेशन काम होगा, इसलिए हम बाहर अभी निकले हुए हैं। हम सब मिलकर एकजुट होकर काम करेंगे, जैसे लोगों को तकलीफ ना हो।
Relief and rescue work is underway by teams of NDRF in both affected states. National Disaster Response Force, along with state authorities, army and coast guards, are working to rescue people who've been stranded due to a surge in water levels in uprooted trees. Teams also carried out road clearance work where uprooted trees and blocked the roads. Along with this, a team of Red Cross has also distributed relief material and food packets. A team of the paramilitary force also rescued a mother and her newborn child from a flooded village in Balasore district of Odisha. Keeping in mind the impact of the cyclone, commercial flight operations were suspended, but apart from Rourkela Airport in Odisha, remained suspended even on Thursday. Alert was also issued in Patna and Darbhanga Airport, keeping in mind that the remnants of the cyclone will be felt in those states as well. After leaving a trail of destruction in Odisha and Bengal, the cyclone has now reached in Jharkhand as a deep depression. Most parts of Jharkhand and South Bihar received heavy rains. The remnant of cyclone Yas is not yet over and done, and more heavy rains accompanied with strong winds are expected in the next 24 to 48 hours over Jharkhand, Bihar, Odisha and West Bengal. Light to moderate showers is also expected over North Chhattisgarh and East Uttar Pradesh in the next 24 hours. A close watch is being kept by disaster management in various districts. An uninterrupted supply of electricity is being maintained by state administration for hospitals and for oxygen plants in the state. The worst may be over in terms of the destruction and havoc caused by the cyclone, but it will be long before life once again picks up pace in those states which were affected by the natural disaster. Bureau Report, DD India.
And some update from the world of sports. Manager Zinedine Zidane has left Real Madrid for the second time in his coaching career. Real failed to win a trophy this season and were pipped to the La Liga title by city rivals Atletico Madrid on a dramatic final day. Zidane won 3 consecutive Champions League titles in his first period in charge between 2016 and 2018. He returned to a club in disarray 10 months later and secured a second La Liga title as manager last season. Not since the 2009-10 campaign have the Real failed to win a trophy. They suffered an early exit from the Copa del Rey at the hands of a third division side and lost to Chelsea in the Champions League semi-finals. Zidane is expected to be an immediate target for Juventus or France national team following his departure from Bernabeu. And that brings us to the close of this edition of Newsnight. Namaskar.